Hello everyone. In this series of gynecology, today I will be discussing on the topic of vaginal infection, that is vaginitis, and today I will be mostly discussing on three differential diagnosis of vaginal discharge or vaginal infection, that is trichomoniasis, candidiasis, and bacterial vaginosis. We will see the characteristic feature of these three diseases, their causative organism, clinical feature, diagnosis, treatment, and we will compare between these three. So first of all, starting from trichomoniasis. So vaginal trichomoniasis is the most common and important cause of vaginitis in the childbearing period. Usually, it is caused by the protozoa named Trichomonas vaginalis. Trichomonas vaginalis is a pear-shaped unicellular flagellate anaerobic protozoa. It measures around 20 micron in length and around 10 micron in width. It is larger than WBC, and it has got four anterior flagellate. It has spear-like protrusion at the other end, and it has one undulating membrane surrounding the anterior two-third part of the uh, its cell, and it is actively motile organism. So talking and this Trichomonas vaginalis is transmitted by sexual contact, predominantly by sexual contact. The male harbors the infection in urethra and prostate. It is highly contagious sexually transmitted infection, and the transmission may be possible by also by some other toilet articles from one woman to another, and also through examining gloves. So usually the incubation period is around 3 to 28 days incubation period. And talking about uh, its clinical feature, usually that in about 25% of women in reproductive period, this parasite harbors in vagina in asymptomatic state, where when there is a impairment in local defense during and after menstruation, after sexual stimulation and following illness, the pH of vagina is raised, that is reaches around 5.5 to 6.5 from the normal, that is 4.5. And at this high pH, the trichomoniasis thrive, they grow, and the organism causes this infection. So talking about clinical features, there is sudden, profuse, and offensive vaginal discharge. Uh, there is sudden, profuse, and offensive vaginal discharge. This is foul smelling. There is irritation and itching are of varying degrees around the introitus. There are some urinary symptoms like dysuria and increased frequency of urine micturition, and history of previous similar attack in the past. So these are the clinical feature and of the trichomoniasis: sudden, profuse, and offensive vaginal discharge, irritation and itching. There is urinary symptoms, that is dysuria and frequency of micturition, and history of previous similar attacks. And on examination, what we can see is that the vaginal discharge is very thin. It is gray, yellow, or green, or it is maybe greenish yellow. It is frothy. The vaginal discharge is frothy. It is offensive, and pH is usually greater than 4.5. So this is the characteristic of vaginal discharge, and it is very important to remember this characteristic. It is thin, gray or white, yellow or green, frothy, offensive. So, and about the diagnosis, we can diagnose the infection by saline microscopy. In saline microscopy, we get motile flagellated organism, and if we do pap smear, the size of organism is same as the nucleus of epithelial cell. If this is epithelial cell and this is nucleus, then the size of organism is almost same as the nucleus of the epithelial cell of the vagina. And gold standard investigation is culture, and the whiff test is negative in this trichomoniasis. So what is whiff test? uh, we will talk this later on when we discuss about bacterial vaginosis. And about the treatment is metronidazole 500 mg from oral, twice a day for 1 week. Metronidazole 500 mg oral 2 times a day for 1 week. Or we can use metronidazole 200 mg for 3 times daily for 1 week. Or we can give metronidazole 2 gram stat single dose for one single dose, and for 2 gram single dose metronidazole it may be given either this or this 500 mg POBD for 1 week. And metronidazole is absolutely safe in pregnancy. We can give to the pregnant woman, and it is usually recommended to women that they should avoid taking alcohol for 25 hours after metronidazole. Why? Do you know the reason? If you know, then please mention in the comment section. Actually, what happens is that the metronidazole has disulfiram like reaction, and it will cause the symptoms of disulfiram toxicity. And this safe in pregnancy, it is safe in pregnancy as we have already said. And the treatment of partner is also done. The same treatment is scheduled for 1 week. That is metronidazole 500 mg for 1 week. We have to treat the partners too in the Trichomonas vaginalis. So that was about trichomoniasis. And one is important thing about trichomoniasis. In post-speculum examination, we can see the strawberry appearance in the vagina. There is a red vagina wall becomes red and inflamed with multiple punctate hemorrhagic spots, and even this type of spot is also seen in the portio vaginalis part of cervix. So this has the appearance like the strawberry, the red colored mucosa with the punctate hemorrhagic spot. So that looks like strawberry. So that is called strawberry appearance in the portio vaginalis part of cervix. So that was about Trichomonas vaginalis infection. And another important thing is that the women with trichomoniasis should be evaluated for other STDs like including Neisseria gonorrhoeae, chlamydia trachomatis, and HIV. So that was about trichomoniasis. Now we will see about candidiasis. It is also known as moniliasis, and it is caused by the fungi named Candida albicans. It is gram positive yeast-like fungus. And there are various risk factors for this infection. First of all is like pregnancy, diabetes, broad spectrum antibiotic use, combined oral pill, immunosuppression, drugs, thyroid, parathyroid, and obesity. These are the risk factors for Candida albicans. Diabetes, pregnancy, broad spectrum antibiotic, COP, immunosuppression, drug, thyroid, parathyroid, and obesity. So